You're dispatched to a car accident involving a 25-year-old female.
BSI is my scene safe.
Your scene is safe.
I have my PPE. My mechanism of injury is a 25-year-old female who was hit by a drunk driver. Is this my only patient?
Yes, that's your only patient.
Okay, so right off the bat, I'm going to go ahead and request additional EMS. I'm going to consider C-spine at this moment and have my assistant partner hold and then mobilize the C-spine. And my generalized impression of this patient is poor. I do want to gain level of consciousness. Ma'am, are you okay? Okay, my patient responds to verbally, so I'm gonna say that her airway is patent. I do want to ask, are you hurting anywhere? Okay, so the patient chief of complaint is a headache and being hit by a car. I do also notice that she has a laceration on the top of her head. So I'm going to just take my bandage and apply pressure to stop the bleeding. Okay. Has the bleeding stopped?
Yes.
All right, so I'm going to go ahead and assess my patient's airway, starting with a jaw thrust, opening the patient's mouth. Do I know any violent secretions or loose teeth inside the patient's mouth?
No.
All right. Patient's airway is open. If the patient airway was not open, I will insert an adjunct at this moment. Breathing. I'm going to go ahead and check the patient's breathing. I'm going to first look for adequate chest rise and fall while I'm listening to the lungs. All right, lungs are equal and bilateral. Do I notice anything about the lungs? All right, so now I'm gonna go right into circulation.
The patient's breathing at 26 beats per minute.
All right, so now I'm gonna just go ahead and issue oxygen for this patient. I put her on a non-rebreather, 15 liters per minute, with one ventilation every 5 to 6 seconds. I'm now gonna go ahead and do circulation, starting off by checking my patient's skin. Skin is warm, pink, and dry. Do I notice anything about my patient?
Patient's skin is cool, diaphoretic, and clammy.
Okay, so along with the non-rebreather, with the oxygen, I'm also going to treat this patient for shock, laying her in the supine position and giving her a blanket. I do want to identify this patient as a priority transport, so we're going to make this immediate transport. Major bleeding that I need to control. And I'm going to start, go ahead and just make her trauma naked at the moment.
There's no major bleeding.
Huh?
There's no major bleeding.
Okay, thank you. And I'm going to also make her trauma naked. Next, I'm going to just go right into the history tape, and I'm going to start off with her vitals. Okay, vitals, I got 120 over 80. What is her simulated vitals?
70 over 60.
70 over 60. Okay, so along with her vitals and respiration, we already know that this patient is going through shock, which she has been treated for. I do want to attempt a sample history, but hello, ma'am. How are you? Are you allergic to any medications or taking any medications at this moment? Right. What was the last thing that you ate or drank? Breakfast this morning. Okay. Do you have any past medical history? All right. And during this event, what happened? What were you doing during the time that you got hit by a car?
I was just trying to
Okay.
get out of nowhere.
All right, so I'm going ahead and do my patient assessment, starting off with the head, checking for any deformities, contusions, abrasions, punctures, penetrations, tenderness, lacerations, or swelling, any burns. I'm gonna also go ahead and check my patient's ears, looking for any spinal fluid leaking out the ears, any vital signs behind the ears. I'm also going to check my patient's pupil. They are round, equal, and reactive to light. Also going to check my patient's face for any decap, BTLS. Okay, around the nose. Do I notice any bruising around her eyes?
Not noted at this time.
Alright, I'm also going to check my patient's neck, looking for tracheal deviation, JVD. Okay, I'm also going to check my patient's spine, looking for any step-offs. Right, now I'm going to assess my patient's collarbone, just palpate. Alright, so at this moment, I'm gonna now go ahead and apply my C-collar to my patient. I wanna first see if this is the right size. Measuring it with my apply the collar after we look for jugular vein distension. Alright, so I'm gonna go ahead and start off with my palpating my patient's chest area. I'm gonna go ahead and also take the lungs, the chest, listening to the lungs again. Do I notice anything about the patient's lungs?
No.
Alright, ma'am, can you take a deep breath in for me? Good job. One more time. Alright, thank you. I'm gonna go ahead and have my assistant partner check the lower extremities for me while I do the upper extremities. Ma'am, can you grab my finger for me, please?
Normal
So I'm gonna check both pulses on this side. Pulses is equal, bilateral.
Can you feel me touching your toes right now?
Yes.
Okay. Can you wiggle your toes for me? Can you tell me which foot I'm touching?
What?
Okay.
Ma'am, and if anything that's hurting you, I'll spin your head.
That's my
Okay, which arm? Okay, patient shows that she has a sprained wrist, a dislocated wrist as a secondary injury. I am concerned about that, so I'm gonna go ahead and have my assistant EMT split that for me. I'm gonna start by having my partner split the arm that is damaged for the patient.
Okay. I'm gonna first size it on the uninjured arm. Okay. My partner hold the limb immobilized while I start wrapping and putting the splint on. I'm gonna make sure to leave the injured area open.
Okay, ma'am, so we're gonna just give you a long roll real quick, so we need you to give yourself a hug, please. Just let me know if this hurts or not. Alright, so I'm gonna start off by putting my hand on her shoulder, have my partner put her hand on the top of her hip. We're gonna do the roll at 3. 1, 2, 3. Roll. Alright, so now I'm just gonna check her back, doing a walk down her spine, looking for any step-offs. I'm also gonna check her lower back, checking for any decap, BTLS, step-off. Alright, so then on the count of 3, we're gonna put this patient back down. 1, 2, 3. As we already placed her on the spine board, she is packed and ready to go. We're going to reassess this patient every 5 minutes because of her condition. We also want to keep continuing checking her airway, breathing, and circulation, and we want to also make sure that all these bleeding is controlled.
And we're also gonna report to the hospital that we're 5 minutes out and on our way.